Welcome to the IBODY here in San Marino. I'm Dr. Tostado, and I want to talk to you a little bit of my journey as a physician. When I was young, growing up in Boyle Heights, I wanted to get into the health field because I wanted to help people. Growing up in a poor community, I saw how we were very much in need of this profession. And so, going through my education, going through college, New York, then medical school, I started seeing the process in terms of what medicine was about. And I have to say that even in medical school, I did have certain questions as to what it was that I was asked to learn. Because in medical school, we look at a lot of symptoms and we study a lot of drugs, and it really brought a certain notion of the lack of truly understanding what the body, what might be going through. And so I went ahead and completed my medical education, and I started working at Kaiser as a family practice doctor. And of course, we are taught to listen to the client, listen to the symptoms, and give the appropriate prescription. So initially I felt great. So I was doing my job, I was helping people, I was keeping their sugar stable, their blood pressure stable on all these medications, and doing the appropriate blood work, and seeing that the levels were normal and that they were being maintained adequately on their dosages of prescription medication. But after doing this for a few years, what I really started realizing was I was maintaining my patients stable with their disease. I wasn't so much healing them or helping them get rid of disease, but I was prescribing more medication and making their lists longer so that the disease could stay essentially stable. And so what I thought was, what we really have here is a disease care system versus a healthcare system. When you graduate from medical school, you take what's called the Hippocratic Oath. Hippocrates stated millennia ago, let food be thy medicine and let medicine be thy food. Well, the reality is that food and nutrition is not taught to us in medical school. Doctors, in general, know medications. We know how to look at symptoms, make a diagnosis, and give a prescription. So I started really questioning what I was doing and started taking a step back and looking at this whole situation and system objectively. And what I realized was I didn't feel like I was actually helping people. I'm a doctor, I studied, I'm educated, but at the same time, I was going through a crisis. I felt, how can I be helping these people if I know that these medications I'm prescribing is causing harmful side effects, very severe side effects? So I started going to conferences that had nothing to do with what I learned in medical school. In fact, I felt a massive void in my education, and by going to these conferences that exposed me to physicians who felt similarly to myself in terms of wanting to heal and not prescribe, I was realizing that there was a different direction in medicine that I could take, because I was really quit medicine. And I told my wife, after practicing general medicine and family practice for 10 years, that I could no longer go home feeling good about what I was doing, with all these prescriptions and potential side effects, and then medications being recalled because they were causing death. It would make any sense to me. So instead, my wife and I had a discussion, and what we decided was to embark on this whole different journey, learn what we didn't learn in our medical education. My wife is a nurse practitioner, and see if we could help people at a much deeper level through nutrition, through detoxification, through assessment of blood tests that look at blood genetics, to really understand what health is and provide that for our clients as we do here at IBODY. So along with this journey, I was able to get a clear understanding of what Hippocrates really meant, that food truly is our medicine. Now, that's a big challenge for us today, though, because a lot of our food is made of chemicals and preservatives, antibiotics and hormones, which cause a lot of harm to our body. And as physicians, we're taught to do no harm. So with this combination of prescription medications and their potential with side effects, and food that is being produced today that definitely causes disease with all of these toxins and now GMOs, we have to carefully navigate through this modern world of ours so that we can become healthier. So we educate our clients and empower our clients on what food truly is and what it isn't, and to understand what the whole process of detoxification is and nutrition, so that going forward we can help people truly eliminate disease. We've helped many people literally eliminate diabetes, high blood pressure, cholesterol issues, thyroid issues, by addressing their nutritional needs and by removing the toxins that have accumulated in their bodies for so many years. So this whole journey, as we continue to grow, is truly about the basics. There's nothing new, but what we are teaching in this modern setting, in this modern world of ours, are these beliefs and practices of ancient cultures from throughout the world that have helped for thousands of years. And there's nothing new that I'm teaching my clients, but what they are understanding is what truly nutrition and body balance and energy is. And this is where I am today, helping my clients understand that yes, there is a medical system that gives them prescriptions for their disease, but there's a different mindset as well, and that is, why not live without disease? Why not live with more energy? Why not live in a way that you're preventing disease through your food and through healthy supplementation, so that you don't have to worry about side effects and risks and the potential disastrous outcomes of having a disease for 10, 20, 30 years. Losing your sight, amputations, kidney failure, liver failure, Alzheimer's disease, all of these things that can be prevented by opening yourself to the idea that there truly is an alternative, and that alternative is nutrition and the understanding of your body through very specific blood testing that unfortunately isn't taught to us in medical school. But blood testing that will show us specifically if we do have any vitamin deficiencies or genetic tendencies, so that now we have a roadmap to your health. And this is the passion that I have and that I share with all my clients, so that by educating them and empowering them, they can have a much clearer understanding of their bodies and feel the energy, understand that what they put in their bodies makes all the difference in terms of their health, their happiness, their energy, and their vitality, and ultimately their longevity. So I'm all about health, I'm all about energy, I'm all about vitality going forward in a very fruitful manner. And this is what I have learned through my journey of medical education, looking at it very objectively and embarking on health and prevention, not treating disease, but promoting health and longevity. Thank you very much. I'm Dr. Tostado from the IBODY in San Luis.